Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone, and welcome back to the Hair Loss Show. My name is Dr. Vikram Jayaprakash, and today I wanted to go back and discuss a little bit more about derma-rolling. We've covered derma-rolling in the past, but I specifically wanted to sort of break down a little bit and find out where derma-rolling actually sits within the sort of ecosphere of treatments for hair loss. So just quickly to recap, derma-rolling is basically causing micro injury points to the surface of the scalp. And there are various devices, there are pens, or there are sort of wheels with small little needles on them, and they come on different sizes. And basically what you do is you roll them onto your scalp, and these cause micro injuries. And what that results in is increased blood flow to the area. It brings more growth factors, and what that does is it stimulates the existing hair to grow. And if I look at derma-rolling, it's sort of taken on a little bit of going through a bit of a renaissance. It used to be recommended many years ago, and then it sort of plateaued a little bit. And then recently, a lot of people are using it as a therapy again, and people use it for hair loss. People use it for other cosmetic areas as well, such as the face. You can derma-roll on the face. That stimulates collagen production and improves skin tone and skincare. There are derma-rolling home devices, so you can buy little derma rollers and use them at home, or there are devices that you can use in a clinic setting that are slightly larger needles and therefore give you theoretically greater effect. But today, what I wanted to talk about is, who is the best candidate for using a derma roller? And the reason I wanted to talk about that is that I see pictures of people who have lost hair and have gone, I've just used a derma roller and look, it's all come back. And that's great. I have no reason to doubt the truth in those stories. But it has not been my experience. I've not seen those results in my practice. Now, part of that may be because the group of people, the population of people that I see are probably that much further on in their hair loss journey that maybe derma-rolling is not so effective. But I think there are scenarios where it can be useful, and I think there are scenarios where it's probably not going to be of great benefit. And I thought I'd talk a little bit about why that's the case. So where it's probably not very useful is in scenarios where you've got active hair loss. So if we just quickly, if we look at derma-rolling, if we look at male pattern hair loss is caused, there's a genetic component, there's a hormonal component, and derma-rolling sits more in the side of stimulation therapy like minoxidil, platelet-rich plasma, low-level laser. So it doesn't address the underlying cause of why someone is losing hair in the first place, and what it's doing is it's stimulating hair. But if you've got someone who's got active hair loss, and so which means that with each passing year, the hairline is, for example, moving back, or the crown is getting progressively larger and more sparse, I think in those scenarios, with the active hair loss, it is unlikely, derma-rolling is unlikely to be of benefit, because the process is quite aggressive, and it implies that there's more of a hormonal impact at play there. So I think in those scenarios of people that are aggressively losing hair or consistently losing hair, then derma-rolling, it's fine to use, but I don't think it's going to give you a huge benefit for the effort that is going to be put into doing that on a regular basis. I think probably where it is slightly more beneficial is for the more stable people. So someone who has lost a little bit of hair, but is stable now and is not actively losing. So they haven't lost, say, a significant amount over the last 12 months. But they're a little sparse at the front. Maybe using a derma roller in that area may stimulate that hair to thicken up slightly. So I think there may be a role in that scenario, but I think as a blanket therapy for everyone to say, oh, look, you're losing hair, try Derma-Rolling, it's definitely going to be effective. I think you have to be mindful of where the limitations are. I think the relative risk is low, but you've got to understand where it sort of fits in and what the patient selection would be that you're going to get a beneficial outcome. So hopefully that sort of clears that up. Once again, thanks for watching. Please leave a comment or a question in the comments below, and we'll aim to get to as many of those as we can. Thanks again for watching, and we'll see you soon. Take care.